Many thanks to you for choosing GHOne News. Now, government has disclosed that it has successfully operationalized 169 one district, one factory enterprises across the country, which has led to the creation of job opportunities. Speaking during the greater edition of the regional town hall meetings and exhibitions, Minister of Finance Dr. Mohammed Amin Adam, together with the Greater Accra Regional Minister Daniel Titus Glover, updated participants on developmental projects in the region and pledged to enhance citizen engagement and foster inclusiveness.
The town hall meeting themed Regional Revitalization, Government's Commitment to Growth, Development and Prosperity brought together government officials, youth groups, union representatives and community leaders to discuss critical governance and economic issues, share ideas and provide feedback for sustainable development and policy refinements. According to the Minister of Information, Fatimatu Abubakar, the town hall meeting, which will culminate into a national forum, aims to decentralize government communication and bridge the gap between the government and the people, ensuring everyone contributes to Ghana's growth and prosperity.
We believe after 7.5 years of the mandate given to the President of the Republic, Nana Addo Dankwa Akufo-Addo, the Vice President of the Republic, Dr. Mahmoud Bawumia, it is now important that beyond the discussions, we bring you the updates, real-time updates as to the various projects that we've done in the municipalities and in the districts. This is the reason why, for us at the Ministry of Information, we deemed it very important that we collaborate with our key stakeholders and go to the various regional capitals and show what government has achieved over the period.
Outlining government's achievements and projects in all 29 districts within the region, the Greater Accra Regional Minister, Titus Glover, assured participants of government's continuous commitment to provide quality health care, roads, education infrastructure, and economic empowerment at the grassroots level.
What are our achievements in the past years? Sometimes you hear the opposition saying that too much is given, much is expected. So things that we have done in the region is what we want to show to you, both from central government then to our respective assemblies. Key infrastructure projects. We all know the Pukwase interchange, the 4th year that we drive going to Gan West on our way to Nsawam. We also know of the Baltema, either to School Junction and Maijo, through Baltema to connect to the motorway. You can't drive there. The road is so appalling. But today, it's like Dubai. You drive through the road, and it's a testament of what the government have done.
Answering questions from journalists during the town hall meeting, Finance Minister Dr. Mohammed Amin Adam disclosed that the government has successfully operationalized 169 one district, one factory enterprises across the country. This, he believes, has translated into employment for many in the various districts.
To date, we have 169 fully functional factories that were established under 1D, 1F. 169 fully functional factories under 1D, 1F.
Over the next few weeks, the Ministry of Information will visit the remaining 15 regions to further engage citizens and gather feedback on government projects and policies.
The Member of Parliament for Lejokoko constituency, Benjamin Aiku, has challenged Dr. Bernard Okobo to produce evidence of work he did for the people when he was the MP. According to him, Dr. Okobo, who is currently the Health Minister and doubles as the New Patriotic Party's parliamentary candidate for the area, is also not a threat to his re-election. Benjamin Aiku, the MP for the area, who was speaking to GHOne News on the sidelines of Global Legacy Network Foundation's graduation ceremony at Teshi, said this is his mandate and his people will renew same at the 2024 December polls.
I'm very, very focused. Posters, billboards, they don't vote. Places that have done some governmental projects, there are people there to attest to it. So I'm very focused. Very focused. You can see the pictures that is displaying all. It's within this time. We want him to display what he has done when he was given the mandate 4 years ago. Not now. This one time, this one period, this is my mandate. So we are very focused. Myself and my team are very focused, and we know we are doing things that the people themselves are looking for.
You mentioned about the project.
Now, the Bemuhini of Teacher Mante Nana Ojidom Ohianieku Asaman has raised concerns about the selection process for the Livelihood Empowerment Against Poverty Program beneficiaries in the Ayenswano constituency, specifically in the Teacher Mante community. He argues that the program's targeting is flawed and benefits individuals with political connections rather than the truly vulnerable, thereby defeating the purpose of the program.
The Livelihood Empowerment Against Poverty, LEAP, is a cash transfer program introduced by the government of Ghana in 2008 for extremely poor and vulnerable households targeted at orphaned and vulnerable children or persons with severe disability without any productive capacity and elderly persons who are 65 years and above. However, according to a June 27 press release, the Ministry of Gender and Social Protection announced that LEAP beneficiaries will receive double the amount they received in June 2023, following a delay in payments. The government allocated 103,251,072 Ghana cedis to benefit 324,073 households, with 25,715 households already receiving support, representing about 8% of the total number of beneficiary households nationwide. But the Bemuhini of Teacher Mante, Nana Ojidom Ohinieku Asemanin, has criticized the LEAP program for allegedly misallocation of funds and resources. The Bemuhini stepped in to support the vulnerable, making various donations to widows in the community. He claims that the program in Ayenswano, particularly in Teacher Mante, favors individuals with political connections rather than those in genuine need.
Yes, the LEAP program at the Aba. Ghana buying at the share for any Nema. Ampa Aban Bonabas was Adiana or yeah, no mono. Ayenswano ha. Ebi eni hasa kakra eba ene nso no omo de aye amanyosem politics it is a unka sa aban no ho a womo emwa sa won ni sa party ni mu a sa amwan unya bi edu samri a best yenyi amanyosem entu nchen na yemwa ne osefata li program yi ekoso bebre na so bekom kura no na won a wode ma won no kura no sabi wonyo nkrofo wonya moa obi a owo ne nansi ne nan so obetuma ye adwuma na wode LEAP akoma no emwa Ghana emma oman no entumpon.
The assemblyman.
Now, in other stories, a meeting between leadership of the Kolebu chapter of the Ghana Federation of Allied Health Professions, management of Kolebu, and the National Labour Commission on Tuesday ended inconclusively over the Federation's demand for an Allied Health Directorate at the facility. After almost an hour inconclusive meeting, the National Labour Commission directed the feuding parties to return to the negotiation table on 14th August. Here are excerpts from the meeting.
Listening to both parties, they decide that based on evidence that we provided, they need to wait for 1 more week, after which they will call us back to listen to us. Because the Minister of Health has intervened and we made it clear to them that they're supposed to be a meeting scheduled for tomorrow, by the Minister of Health. We have only one expectation: a Director of Alliance is created, and the Minister, we believe, after engaging the board, will make a pronouncement to that effect.
If that fails?
We don't want to get there, but in case it happens, obviously, as leaders of a very sensitive organs in the hospital, we will not take it lightly at all.
We want to assure our professional association members to exercise constraint because the minister himself is intervening to make sure that the issue is resolved, and therefore we want them to be at peace as the minister and the Kolego management and also the National Labour Commission facilitate the process.
And we expect our members to go back to work. They should continue working. This is more about engagement, and national leadership and the unions have taken over. We don't need industrial agitations, and we want to send a humble appeal to the management of Kolego Teaching Hospital and all state actors that balloons don't rise because of their colors. They rise because of what is inside them. And we believe that unique professions should be given the empowerment and support to grow. And there should not be the situation where we'll be playing professional politics where people tend to favor others against the detriment of the other. So allied health of over 22 professions, they deserve adequate representation at the core management level, and that should be granted to them.
Now, the national chairman of the Senior Staff Association of Universities of Ghana, George Anson Yilebu, is concerned by what he terms a trick played by government on the three teacher unions who intend to lay down their tools come Thursday, 9th August, should government fail to heed to their demands. The three unions, Senior Staff Association of Universities of Ghana, the Federation of Senior Staff Association, FUSAC, and the Teachers and Education Workers Union of the Trade Union Congress had earlier announced this strike owing to non-payment of vehicular maintenance and other allowances. Speaking to GHOne News, Yilebu said the exclusion of their associations from these allowances, despite numerous letters to the finance minister, is blatant discrimination against them.
It's turning to be like animal farm, where some legs are good, some legs are bad. The point is that these allowances we are talking of has been in the system since time immemorial. And every time there is a review, anybody who qualifies gets his or her share. And so it is only this year that the review came and they said, we the senior staff and the junior staff, we don't qualify. So we threatened to embark on strike. Then the National Labour Commission intervened and invited the parties.
All right. So share with us more. Are you still on the line?
Yes, I'm on the line, please.
Kindly go ahead. Continue with your point.
All right. So subsequently, the wages invited us. We met an agreement. Agreement was
Now, the Pediatric Society of Ghana is demanding a concerned approach in ensuring exclusive breastfeeding. Exclusive breastfeeding is the sole feeding of babies below 6 months on breast milk. The Ghana Statistical Service, however, reports this is not implemented for half of babies in the range. Vice President of the Pediatric Society of Ghana, Dr. Emmanuel Opong, in an interview with GHOne News, emphasized stakeholder support is needed to ensure exclusive breastfeeding.
The Pediatric Society of Ghana, over the past few years, have constantly celebrated and created awareness about breastfeeding. This year, we are taking it to another level. Yesterday, we had a massive launch online where we have almost 500 healthcare workers and general public members joining to launch the Breastfeeding Awareness Week That's what the WHO has advised countries to do. But because of how important this issue is, the Deaf Society of Ghana has rather decided to dedicate the whole month of August, not just a week, to creating awareness about breastfeeding. That means that most of our members, the society members, and anyone who is interested in the welfare of the Ghanaian child is going on air, is going to the marketplaces, is going on the streets, and having education platforms also in the hospitals to educate our mothers, the families, especially the family members who provide this support. We have very interesting stories of grandmothers even discouraging some mothers not to do exclusive breastfeeding by introducing water. So we are stepping up our education as society, and we're inviting everyone on board. However, this is just at one level. What we are encouraging is that the breastfeeding campaign will be taken to all levels. We will be taken to policy level, where we will begin to have a stronger conversation beyond having the maternity leave for 3 months to 6 months, so that we are consistent in the communication and the advice that we are giving to the community in terms of how long we should do exclusive breastfeeding. We are also inviting our partners to help us have trainings for healthcare providers, midwives, nurses, so that whatever challenges that we have in the hospitals, like nurseries, like breastfeeding rooms, we are able to set them up. One of the areas that we are also looking at is how do we partner with the Ghana Education Service, for example. We have a number of our mothers who are teachers. How do we have nurseries? How do we have breastfeeding rooms, even in the schools, so that when teachers go to work after the 3 months, they are able to comfortably have a room to express milk and breastfeed their babies. So these are conversations that we'll continue to have, and we are encouraging all our partners to come on board. A mother has the right to breastfeed anytime and anywhere, and it's high time that we set up these breastfeeding centers and nurseries to support them.
And on that note, we end GHD News this morning. There's more news when you log on to starfm.com.gh. I am Nurain Abbas. Many thanks for your company.